Health-Wise, brought to you by Winona Health. Healthy starts here.
Get down!
Today on Health-Wise, we're going to talk about women's issues, and we're going to talk about postmenopausal bleeding. And with us today to do that is Dr. Melissa Richards from Winona Health, and thank you for being here today.
Thank you for having me here.
Now, I guess first of all, the question would be, what is the definition of menopause?
That's an excellent question that we don't really teach women necessarily when they come visit us at the doctor's office, but by definition, menopause is 12 months without any vaginal bleeding. The average age of menopause is age 51, plus or minus a few years depending on each individual woman. Other symptoms that come with menopause: hot flashes, night sweats, mood changes, but that bleeding, going 12 months without having any bleeding, is definitely the definition of menopause. So a woman who goes 6 months without any bleeding and starts having her periods again isn't in menopause. She's in a perimenopausal state. When she goes those 12 months without having a period, then she's in menopause.
How common is postmenopausal bleeding?
Postmenopausal bleeding is fairly common. It affects approximately 7 to 11% of postmenopausal women. Can
it be life-threatening?
This can be a life-threatening condition in the event that this is something like endometrial cancer or cancer of the uterus. When we use the term cancer of the uterus, we either use the terminology uterine cancer or endometrial cancer. The chance of a woman with postmenopausal bleeding having cancer of the uterus is about 10%. That is why it is very important for any woman who is having postmenopausal bleeding to be evaluated. 90% of the time it's a benign or non-cancerous reason that she's having this bleeding, but that is why it is so important for these women to come and see her healthcare provider.
When does postmenopausal bleeding usually begin?
Postmenopausal bleeding tends to be more prevalent or more apparent earlier on in menopause, in menopausal years. However, a woman who is 80 who comes in with postmenopausal bleeding isn't necessarily uncommon.
What are some of the causes?
The non-cancerous or benign causes of postmenopausal bleeding, most commonly vaginal atrophy. The lining of the vagina has thinned out due to the decrease in estrogen that you were having during your premenopausal days. That oftentimes is a cause of a little bit of spotting or bleeding. Polyps or little skin tags within the uterus are very common and quite bothersome, need to be removed. And hormone replacement therapy that we as providers oftentimes put patients on can cause postmenopausal bleeding also.
What types of treatment are available?
Treatment for postmenopausal bleeding. When we're talking about treatment for postmenopausal bleeding, we really need to know what's causing the postmenopausal bleeding. If this is an issue with the lining of the vagina being atrophic or thinning, there's a medication that we give women. If it is an issue with a small uterine polyp or a skin tag within the uterus, we will remove that. If it's an issue with her hormone replacement therapy that we have her on, we will adjust. If it's an issue of something more sinister, such as endometrial cancer or a precancerous condition, then there are surgical options and non-surgical options available.
Thank you so much for taking time to talk with us today.
Thank you.